All right, in this video, I'm going to walk you through the various muscles and structures associated with the leg. Okay, so what I'm going to do is basically kind of start down here at the bottom. This is an inverted leg, obviously, since you can see the feet, the foot is up in the air. So back down here by my table would be the muscles of the hip. Then you got in the muscles of the thigh. You can see musculature and a lot of the tendons associated with the knee. Then you get into the lower leg, and then finally the foot. So like I said, I'm going to start down here and kind of work my way there. So I'll go proximal to distal. All right, what we're looking at here is an anterior view. As you can see, there's the toes pointing back at me. If I were to flip it around, this would be the posterior view. So we'll start with the anterior view, and we'll talk about some of these major anterior muscles. So I'm kind of move down here so I can get a good look at it. If I turn it just slightly sideways here, right now I'm kind of looking at the lateral view. Two major muscles are visible right away. The tensor fasciae lata muscle, one of the important hip flexors, and then the big gluteus maximus muscle, which is one of the big butt muscles. If I kind of show you, you can see that these two kind of share a singular tendon that runs down the lateral side of the thigh all the way down past the knee. We call that the iliotibial tract, or the IT band, kind of for short, is kind of its nickname. Okay, now if I kind of rotate it back here to the anterior view again, right away I'm going to kind of be able to point out some of the quad muscles. So first things first, we have right down the middle the rectus femoris muscle, and then on both sides of it you'll find two vastus muscles. On the lateral side you'll have the vastus lateralis, and then on the medial side you'll have the vastus medialis. And then pulling this rectus femoris off, I can now expose the vastus intermedius muscle, which is deep to that rectus femoris muscle that I just pulled off. So I'll stick that back on. One thing that I like to highlight when I'm right there talking about the quads is the fact that they share kind of a tendon. Number 54, which is upside down here, since my leg's upside down, is the quadriceps tendon. And if you follow distally or inferiorly, as I move up, but really down the leg, this bulge right here would be the patella tendon, and then inferior to that would be the patellar tendon. So above the kneecap we have the quadriceps tendon, below the kneecap we have the patellar tendon. Okay, and that's an important distinction that needs to be made. Now, if I can kind of zoom back here down towards the hip, and I can follow this muscle across the leg from lateral to medial, we can see the sartorius muscle. I've had students in the past kind of think of it kind of like a seatbelt. So sartorius, seatbelt, kind of sounds similar. If I continue moving medially, there's a muscle that kind of looks like the sartorius, except this muscle is kind of a strap-like muscle that just stays medial from the medial hip down to the medial knee, and we call that the gracilis. While I'm right here, I'm going to be able to identify some of the adductor muscles. This muscle right here, which is number 26 here, is the adductor longus muscle. The adductor magnus is number 28, which you can see up here, and you can even see down there. So the adductor magnus versus the adductor longus muscle. If I continue moving to the backside of the leg, I can see that really nicely sized gluteus maximus, and like the rectus femoris, I can actually pull that muscle off so that I can expose the gluteus medius muscle, which is what number 10 is pointing to, or excuse me, number 12 is pointing to right here. Okay. If I move down the leg into the hamstring region, right away we're going to be able to find the three major hamstring muscles, which includes what's number 31, 30, and then 29. Okay, so 31 on the lateral side. Okay, if I come back up, this is my pinky toe, so I'm looking at the lateral side of the thigh, is the long head of the biceps femoris muscle. Like the biceps brachii, there are two heads. Remember, biceps femoris, though, would be located down in the femoral region in the leg. On the medial side of the hamstrings is where you'll find the semitendinosus and the semimembranosus. Superficial is the semitendinosus, and then deep to it, which is what 29 is illustrating, is the semimembranosus. Just like we had before, I can pull some of these muscles off, okay, and that exposes number 21. Again, this is that vastus lateralis that we talked about earlier. It's a quad muscle, but we get a better shot now of the short head of the biceps femoris. As far as I'm concerned for the class, there's really not a big distinction between the two. I just want you to know biceps femoris. So if I stuck it on the long head or the short head, you would just need to know it as the biceps femoris. Okay. Now if I zoom up here toward the calf, we can see two really good sized muscles that are actually the gastrocnemius. They're number 37 and number 38, the medial and lateral heads. Not that I'm super concerned with you knowing that. Just if I stuck a piece of tape on there, you would want to know them as the calf muscles called the gastrocnemius. Okay. If I zoom up here to the back of the ankle, we would find the Achilles tendon, which is more scientifically known as the calcaneal tendon. Now, just like we've seen before, we can pull off some of the superficial muscles. And what's good about this is it illustrates the fact that the gastroc is on the outside, but the soleus muscle is deep to it. And the soleus muscle is not as powerful as the gastroc, but it does provide us with the ability to kind of maintain an erect position and keep our legs extended. So it's kind of a fatigue resistant muscle, allows us to kind of help stand up. Okay, if I kind of twist around here back toward the anterior side of the leg, now we're looking at the tibia here, which is going to help you find what number 33 is pointing to or illustrating, which is the tibialis anterior muscle. And that's a muscle that's going to help perform dorsiflexion of the ankle. On top of the ankle, we have two kind of bands. They kind of form a V, and we've seen those now in the wrist and at the ankle. Since these are on the back side of the foot, or the top side or the dorsal side of the foot, we would call those extensor retinaculums, because they help with extension of the toes and dorsiflexion of the foot. You can see that they kind of hold these major tendons running down into the foot and into the toes kind of in place. This part of the retinaculum we call the superior extensor retinaculum. This part here would be called the inferior extensor retinaculum. Okay, and then the last thing I'm going to do is kind of look at what we can see on the bottom of the foot. What we are able to see are some of the toe flexors, which are the kind of major ones that I want you to know. Now, the only reason that we can see it is because number 63 has been cut away, which is the plantar aponeurosis, which would actually run over all these muscles, so we couldn't actually see it. But it's been cut away. You've probably heard of plantar fasciitis, or maybe not, but it is inflammation in that plantar aponeurosis, and it is a fairly painful condition from what I understand. Okay, so what muscles I want you to know. Number 49 here, you can see is kind of a three-part muscle with tendons that kind of run to 4 out of the 5 toes with the exclusion of the big toe. We call that muscle there the flexor digitorum brevis because it flexes the toes, and brevis because it's a short muscle. And then finally, the other muscle to know is number 51, which is the flexor hallucis brevis. Our halix is our big toe, so that tells you exactly what it does. It flexes our hallucis or halix, and it's brevis, so it's a short muscle. All right, so that kind of wraps up the leg. Thanks.